12 years ago, when Allie Deason-Kowski was 11 and a half, her mother Carla noticed that Allie seemed cranky, tired, and moody all the time. Nothing unusual about that, she figured.
I just thought it was, here we are going through puberty. But when I got the call from school saying, Allie's grades aren't so good, what's going on? And I have an honor student, I started looking into it. And then I noticed that she was really excessively tired in the afternoon. And finally, she started walking downstairs and saying, I've got this weird feeling in my legs, Mom, and I have to get up and walk at night. But when I walk down the steps, and by the time I get there to tell you, it's gone. I don't know what's going on and why this is happening.
It took the Deason-Kowskis 2 years seeing doctor after doctor to get a diagnosis.
5 specialists, 5 different specialty areas. They just didn't know what it was. At one point, I was told, there's nothing we can do for you. You need to go home and deal with this.
Finally, a sleep specialist diagnosed Allie with Restless Leg Syndrome, also known as Willis-Ekman disease.
Restless leg syndrome is a fairly common neurologic condition that is clinically defined. Patients have to have an urge to move the legs, not just pain, but an actual urge to move the legs. It has to be worse in the evening time and relatively better in the morning. And it also has to be worsened by physical and mental inactivity and at least transiently improved by physical activity.
That's Dr. William Ondo, professor of neurology at the University of Texas Health Science Center in Houston and an advisory board member for the Restless Leg Syndrome Foundation.
There is a true circadian pattern to it. It's not just a function of the fact that people are less active at night or trying to go to bed or lying down still, but those things do make it worse, and moving about does at least transiently improve the symptoms. But as it gets more severe, it becomes more and more frustrating, and it can significantly impair sleep in these patients. In fact, studies have shown that patients, when it's severe, have among the worst sleep of any disease that we know of. It certainly can be associated with frustration, depression, and a number of other psychiatric manifestations of disease as well. But simply the frustration of every time you get tired and want to go to sleep that you can't, it certainly would impact quality of life.
Ondo says restless leg syndrome is a little more common in women than men and can happen at any age, though it tends to get worse past age 40. About 10% of people of Northern European ancestry have RLS to some degree, but it's a problem for only 2 to 3%. As you might expect from that, there's a strong genetic component.
There are 6 genes now that have been published that all confer a risk for RLS. So there's not one gene that says 100% yes or no, you're going to have this. But if you have one of these genes, you have, for example, a 50% increased risk of having it. If you carry all 6 of these genes, you probably have about a 90 to 95% likelihood of having restless leg syndrome. That being said, there are certainly people that don't seem to have any genetic predisposition for RLS, and there are a number of other medical-associated things that have been identified. Patients on dialysis from kidney failure are much more likely to have restless leg syndrome. Pregnant women during the 3rd trimester of pregnancy are much more likely to get RLS. It seems that if you're very iron deficient, you're more likely to get restless leg syndrome. This is the case even when serum iron or iron tests done by blood are absolutely normal. So this has been a very consistent pathology or abnormalities seen in the brains of patients with restless legs. There's a number of other things that have been identified. There are some alterations in the way the brain uses and metabolizes dopamine, which is one of the common chemicals in RLS and one of the targets for treatment of RLS. There's some abnormalities in something called hypocretin-orexin. There's abnormalities in glutamate. There's a number of different abnormalities that are seen on a pathologic basis and a physiologic basis in the central nervous system of people with RLS.
Many people with restless leg syndrome will do almost anything they can think of to try and stop the pain and restless sensation.
They get up, they walk around, they stretch their calves, they may exercise at night, they may do things like with sensory stimulation like hot baths or cold baths. So these sorts of things temporarily improve RLS. The problem is this sort of activities are often not that conducive to relaxing and going to bed, which is when the symptoms are occurring. In more drastic cases, you really do hear some pretty astounding stories of people hitting themselves with baseball bats and so forth to try to improve the symptoms on their own.
A survey released by the Willis-Ekman Disease Foundation, sponsored by Zenaport, shows that families are also severely affected by the disorder. About a third of spouses can't sleep in the same bed as a restless legs patient. About half of patients avoid going to the movies or concerts because they can't sit for that long, and about a quarter of patients avoid travel. Carla Deason-Kowski says Allie's restless legs affected their family the same way.
just going out to a social event, going to a concert, to the movies, to the theater, even going to dinner. It took planning. Or, when it was really bad or Allie was having a bad day, we were the family walking the parking lot to try to get her some relief so that she could sit down and enjoy her meal. That's kind of how it is when you have RLS in your family. You just start making accommodations to make it work. So we would maybe go to the movies earlier in the day instead of at night when her symptoms would pick up. RLS sort of is like, if you think of it this way, it's mostly a 6P to 6AM kind of deal, so you're kind of working the night shift, and that's why they call people with RLS night walkers, because they are up walking at night. So we would schedule things around her symptoms so that she would be able to enjoy life, be part of the family, to do things together.
She says once Allie was diagnosed and treated, it made a world of difference.
Her life improved dramatically. Her grades went up. She was able to function, go to school events, participate in school. I mean, she was a completely different person. In her words, she said, "I didn't know what I was missing, Mom."
There are currently 4 drugs which are FDA approved for the treatment of restless legs. 3 of the medications, pramipexole or Pinerol and rotigotine, are dopamine agonists. So these are medicines that mimic dopamine, okay? All 3 of these medicines were invented initially for the treatment of Parkinson's disease. I will emphasize that RLS does not become Parkinson's disease, despite the fact that we use the same treatments for them. So they've been around for actually, more than a dozen years now, at least 2 of them. The 3rd FDA-approved drug is called gabapentin enacarbil, and it works in a totally different way, where it seems to just deaden sensory fibers going up the spinal cord and into the thalamus of the brain. Opioid medications or narcotic medicines, although never typically a first-line drug, also can be fairly effective for RLS. And then giving very large doses of intravenous iron are also sometimes effective for patients with restless legs.
The key, Ando says, is getting a diagnosis. You can find out much more information about restless leg syndrome through the Foundation website, rls.org. Our production director is Sean Waldron. I'm Lynn Holly.
The eyes may be the window to the soul, but a new survey shows that the eyes come in a distant second, and it's a healthy smile that stands the real test of time. A survey by the American Academy of Cosmetic Dentistry shows that nearly half of people think a person's smile can defy the effects of aging, and as people age, they're seeking ways to look younger, according to Dr. Joyce Bassett, AACD president.
More than half of people over the age of 50 believe that a beautiful smile can overcome the effects of aging, and it's true. We're living in a time now when it's possible to turn back the clock. That's why 80% of adults claim they'd spend money to hide or correct signs of aging. And among them, more than 60% would first spend the money on their teeth, far more than the secondary concern of aging, which is excess weight loss.
Learn more about how you can turn back the clock and improve your smile and your confidence with a dentist who is a member of the American Academy of Cosmetic Dentistry. Visit YourSmileBecomesYou.com. That's YourSmileBecomesYou.com.